Welcome to our training video on Adult Foster Care Resident Evacuation Scores, or ESCORES, for adult foster care homes with a special certification. Let's get started. In this video, we will define what an ESCORE is, explain why ESCORES are required, review how providers complete the ESCORES worksheets, and explain how providers determine a facility's evacuation difficulty score. We recommend having copies of the following forms available as you watch this video. Worksheet F1, Side 1 and Side 2, Rating Residents. Worksheet F2A, Finding the Total Resident Score. Worksheet F2B, Finding the Staff Shift Score, and Worksheet F2C, Finding the Home's Evacuation Difficulty Score. A link to these forms is located in the information box below this video. Special Certification Rule ending in 715. Sub-Rule 4 indicates that evacuation assessments must be conducted within 30 days after the admission of each new resident, and at least annually after the admission of the last new resident. A licensee shall forward a copy of each completed assessment to the responsible agency and retain a copy in the facility for 2 years. The Evacuation Difficulty Score, or ESCORE, was designed to minimize speculation about how residents might perform in an actual fire emergency by basing ratings on already observed performance. The Evacuation Difficulty Score, usually called the ESCORE, is a numerical score used to measure how difficult it would be to evacuate the residents of an adult foster care home in an emergency. There are 3 main steps to determining a facility's ESCORE. Step 1 requires providers to rate each resident by completing Worksheet F1, Side 1 and Side 2, following the worksheet instructions. Providers then transfer the information to Worksheet F2A to calculate the total resident score. We will review definitions and resident rating criteria later in this video. Step 2 requires providers to rate AFC staff, as well as the facility by completing Worksheet F2B to determine the staff shift score for each shift. Next, providers complete Worksheet F2C to calculate the home's evacuation difficulty score. These worksheets use results from Worksheet F2A. Step 3 requires providers to determine evacuation difficulty, using the results from Step 2 and other required criteria. Evacuation capability is calculated using a standardized method that includes determining each resident's evacuation assistance needs, assessing the relative evacuation difficulty based on staff response capabilities, adjusting for vertical travel, such as stairs or floors, and calculating the overall evacuation capability score. This score corresponds to one of 3 evacuation capability levels. Prompt: residents can evacuate reliably and in a timely manner, similar to the general population. Slow: residents can evacuate reliably but more slowly than the general population. Impractical: residents cannot reliably evacuate in a timely manner. Providers must complete Side 1 of the F1 worksheet for each resident. This requires documenting observations related to following evacuation instructions, whether assistance is needed, and the type of assistance required. Ratings must be based on commonly observed examples of poor performance, not speculation. If the AFC staff member completing the worksheet is not familiar enough with the resident, they must consult someone who observes the resident regularly. Because emergencies are stressful, residents may not perform as well as they do under normal conditions. Ratings should reflect how the resident performs on a typically bad day, but not rare or extreme situations. On Worksheet F1 Side 2, providers must rate each resident on 6 different risk factors by selecting one option per factor that best describes the resident, then record the corresponding score. For fire drills, providers must rate all 3 categories listed and their total. The highest score from the right-hand column is entered into the box at the bottom. This becomes the Resident Evacuation Assistance Score. Let's discuss each risk factor indicated on Side 1 of the F1 worksheet. Risk of resistance. Providers must rate the likelihood a resident may resist evacuation. Resistance may be active, like hitting or running away, or passive, like going limp or hiding. Complaining or arguing alone does not count as resistance. Levels include minimal risk, risk of mild resistance, and risk of strong resistance. Impaired mobility. Providers must rate the resident's physical ability to evacuate based on the actual layout of the building, their ability to get out of bed or chairs, and the use of mobility devices, only if always available. The need for guiding or leading by the hand is not considered physical assistance. Mobility ratings range from self-starting too slow, needs limited assistance, and needs full assistance very slow. Providers must rate the resident's risk of loss of consciousness based on documented episodes within the past 3 months. Ratings range from no significant risk, partially impaired, and totally impaired. Ratings must be supported by specific evidence such as seizures, fainting, or intoxication. Providers will rate a resident's need for extra help by determining whether more than one staff member is required to evacuate the resident. Providers should not consider staff's strength or weakness. Staff availability cannot be guaranteed during emergencies. Providers must determine a resident's response to instructions by rating the resident's ability to receive, understand, and follow staff-directed evacuation instructions based on their least responsive behavior. Categories include follows instructions, requires supervision, and requires considerable attention or may not respond. Providers will determine a resident's waking response to an alarm by rating whether the fire alarm is likely to awaken the resident. Providers will consider alarm loudness, medication effects, hearing impairments, and history of being a sound sleeper. Providers will determine a resident's response to fire drills by rating the resident's ability to evacuate independently during fire drills. Residents must demonstrate prompt evacuation, the ability to use backup strategies, and the ability to remain at the designated safe location. A yes rating requires demonstrated performance in at least 3 of the last 4 fire drills. Residents not trained or tested must be rated no. Let's discuss completing the remaining worksheets. Worksheet F2A. Providers must enter each resident's name and evacuation assistance score, then add the scores to determine the total resident score. To complete Worksheet F2B, providers must list all staff members on duty and rate alarm effectiveness, determine staff response promptness, and calculate the staff shift score. For Worksheet F2C, providers must rate the vertical distance from bedrooms to exits, calculate the E-score using the formula, and identify the evacuation difficulty level. As we near the end of our video training, let's cover some final notes. E-scores are only valid when a written protection plan exists, staff are trained in evacuation procedures, required fire drills are completed, and all counted staff members can meaningfully assist with evacuation. Thank you for watching our video training on E-scores. We hope you found this information helpful. As always, resident safety is our top priority.